definitely there is a problem presented with lack of easily accessible pharmacy care as we see closures across our country. So that is definitely something that needs to be addressed. I don't think that digital innovation necessarily exacerbates that problem. I think it actually helps that problem because again, it helps the pharmacists be more effective in how they're bringing care to the patient, even in that brick and mortar setting, and certainly can help solve some of that accessibility issue that can exist by directing the patient to a pharmacy that has the most affordable access point and has product available for the patient.
And I also think it could be a solution, right, to some of those
Mm-hmm.
So you think about patient populations who don't have easy access to a pharmacy. Some of these digital tools may provide access they wouldn't otherwise have. And it's not reasonable to drive an hour to get your prescription medication. So if we can, layer in some more distribution models that are more digital based, I actually think that has to be part of the solution to maintain that access point for patients.
I'll give you one. Technology and artificial intelligence are definitely enhancing the pharmacy experience for the consumer, the patient. So yeah, that's a key takeaway, and we all need to embrace that, adopt that, and put that into practice.
I would say the second takeaway is courageous leadership. We need to see some collaboration and
willingness to reach across the ecosystem that is healthcare. We've created a very, very complex system, and as it relates to pharmacy, we need to start breaking down some of those barriers and collaborating and creating some synergy and partnerships that meet patient needs. I think the technology can enable that, and then lining incentives across manufacturers, PBMs, retail pharmacy, these modern delivery, home delivery kind of models, and the patient. So collaborating is going to be key.